There is growing concern about stalling coronavirus vaccination rates as the Delta variant continues to spread. Take a look. The statewide data shows 58.8% of Virginians have received at least one dose. Nearly 53% are fully vaccinated. Those numbers are going up, but much more slowly than they were a few months ago. And we're keeping a close eye on this graph. This one has the yellow line that shows the 7-day average percentage of positive COVID-19 tests. And it's been rising almost every day since mid-June. Right now it's at 2.7%. And it seems the Delta variant may be playing a role in this increase. New at 6, our senior reporter Wayne Koval tells us what health leaders are saying about children under 12 who for now cannot be vaccinated.
The message we're trying to share is that the Delta variant is coming.
As the summer heat continues to move numbers up the thermometer, other rising numbers have some health officials concerned.
What we're seeing in the Richmond and Henrico area is still the majority of cases are the Alpha variant, about 89.7%. The Delta variant is a small percentage, but is increasing. We saw 3.8% of cases in the central region 2 weeks ago, and now we're up to 6.3%.
And health officials believe that number may actually be higher.
We know that not every test gets run for the variant, so we expect that percentage is actually higher.
And as fall and winter bring people back indoors,
we're really expecting that doubling to get faster in the weeks to come.
Which is why Popovich says getting vaccinated is so important.
Information from VDH yesterday is that to date, there's 99.4% effectiveness of vaccine. So that means that less than 1% of individuals who've gotten vaccinated have gotten COVID.
And that's between January 21st and June 25th of this year. Popovich says those vaccinated who come down with COVID have a more mild case, while the Delta variant for those not vaccinated is worse.
It's easier to catch, easier to spread between person, and it has higher severe COVID cases.
One set of numbers on the rise, though, is good news, according to local health officials.
Kids vaccinated, particularly ages 12 to 17, we've seen a pretty steady increase since the Pfizer emergency use authorization was approved for kids 12 and up in early May.
And with children under 12, caution still needs to be taken.
Anytime there are lots of kids gathered who are younger than 12, that means none of them have been vaccinated, and that spread can still happen.
Areas where cases are increasing among adults are at their workplace and where adults spend time with others in close proximity.